Hello everyone, my name is Jordan Heimerman and I'm going to be discussing Chapter 8, Risk Management. So overall, the purpose of this chapter is to help nurse practitioners and future nurse practitioners avoid risk in their future careers. The book defines risk management as what one does to avoid problems later. So overall, nurse practitioners are at risk for two mishaps, both clinical and business. Essentially, it gives examples. So if a patient sees that a nurse practitioner has performed an error, the patient can tell their family and friends, which then becomes a business problem, and no one comes to the practice. However, if a patient ends up being harmed due to a clinical error, then that's when the legal problems can occur. The book goes on to discuss 12 main topics that a nurse practitioner is at risk when they start practicing or start their careers. These include making a clinical error, exceeding their legal scope of practice, failing to disclose important information to the patient, being accused of Medicare fraud, business failure due to undercoding, poor quality ratings, breaching patient confidentiality, being sued for malpractice when there was actually no malpractice that occurred, poor public perception, failure to obtain informed consent, disciplinary action, and being accused of prescribing or dispensing controlled drugs inappropriately. So as you can see, there's definitely a lot of things that we will have to pay attention to as we start our careers. Okay, so for risk of making a clinical error, the biggest thing that we want to avoid as future nurse practitioners is avoiding malpractice, which is the failure of a professional skill that results in injury, loss, or damage. For malpractice to occur, 4 things must be present. So there has to be a professional relationship, there has to be behavior below the standards of care, there must be a causal link between performance and harm to the patient, and there must be actual injury to the patient. And these 4 things actually do have to be proven in a court of law for malpractice to occur. It is important to understand what it actually means to be in a professional relationship. When does a person become a patient? So for example, you're a nurse practitioner and your friend calls you who's a nurse and says, hey, my 6-year-old son has an ear infection and normally amoxicillin works for him. Would you be able to write him a prescription? If you give them any type of medical advice, or if you do prescribe that medicine, that her son then becomes your patient, even though it was through a simple phone call, and even though they don't even actually physically come and see you. What you want to do is you want to manage risk by limiting patient relationships. You want to stick to whatever the norm is. You actually want to avoid these types of favors, so any type of phone call, hey, can I have a prescription? Those are dangerous for you legally and clinically. 95% of the time, nothing will go wrong. However, there still is that small 5% chance that something does go wrong, and then you are sued. The other issue is that you could also violate a collaborative agreement with whatever office you work at. You're not informing that patient's pediatrician, so it's just safer to stick with the overall norm. As a nurse practitioner, you also want to follow the appropriate standards of care, which is defined as what reasonable and ordinary care, skill, and diligence would be given by practitioners in good standing in the same geographic area in the same general type of practice in similar cases. So in a case called Fine versus Kaiser, a patient came in and was having chest pain, and the nurse practitioner actually decided, oh, it's musculoskeletal pain. It's not actually chest pain. Well, it took this person a few visits for them to finally say, oh, you are having a heart attack. Any other practitioner would have ruled out a heart attack before they went to musculoskeletal pain. So there is a means for possible malpractice in this case. Unfortunately, there are cases where a practitioner can be sued when there was actually no error made. Whether or not there was malpractice, it always has to be determined in court, or it can be settled outside of the court. Even if the practitioner does not end up being sued, going through this legal process is still hard. It's personally hard, and no one ever wants to deal with something like this. So with patients that are likely to sue, diffusing a situation is always better than a lawsuit. You want to try and keep your patients satisfied with their care. And it's just also important to keep your patients overall satisfied, because 90% of dissatisfied patients will not even complain. Some common annoyances that patients have with practices are long waits for appointments, long waits in the waiting room, impersonal treatment, or busy phone signals when they try and call their provider's office. So for risk of public perception that the individual NP is a poor quality provider, this is definitely more of a business risk rather than a legal risk. The view of the public does not indicate any type of legality. However, it can drive your business down. So it's important to try to keep up a good reputation when running any type of business or taking care of patients. Some common things that cause bad reputations can include failing to follow up with patients, being inattentive, being forgetful or late, being sloppy in appearance and demeanor, having poor language or intellect, and being unreliable or indecisive. Everyone who works in the world of healthcare understands just how important patient confidentiality is, which is why discussing the risk of breaching patient confidentiality is so important. There can definitely be lawsuits when it comes to breaking patient confidentiality, but it is very hard to prove. So the biggest takeaway from this is that word of mouth can be very bad for business. If a patient starts telling other people in the community that you have broken their patient confidentiality, no one is going to trust coming to you for help. So this chapter gives a great overview of ways to avoid breaking patient confidentiality, and there are some ways that you maybe wouldn't even think about. So you have avoiding talking about a patient within earshot of others, not releasing any medical information without the patient's permission, don't leave phone messages if the patient does not pick up their phone with personal information, do not discuss a patient's condition with family members, do not leave a patient's record within view or in public places, make sure to shred patient records when necessary, do not give patient information to any vendors, do not access medical records for curiosity's sake, and be very careful when faxing patient information, so do not send it to the wrong phone number for the fax. Here I've included just an example of a health release form. So this is something that a patient would sign, which gives you as a practitioner permission to send their health information, potentially to another provider that you're consulting them to, or wherever else that they wish their information to be sent, or that they give you permission. So this is the type of form that one would fill out to help send this information and to avoid any type of legal risk. Another very important aspect of really all healthcare is informed consent. So the book defines informed consent as involving disclosure of material risks of care and requires that a patient be competent to understand the risks and make a judgment about accepting care. A patient is able to sue for two main things: battery, which is unauthorized touching, or negligence, which is not enough information being given. This is overall just extremely important because this is something that a nurse practitioner could get sued for, especially if the consent is not in writing. Then there's proof that informed consent was not obtained. Practitioners do have to be very careful with violating informed consent, and they have to be very aware of what the rule is of their state. So, for example, a state like Minnesota considers something like bed rest a treatment. And so in some cases, they can rule that informed consent was needed for a patient to be on bed rest. Whereas then states like New York only consider things like surgery or invasive procedures treatments that require informed consent. So it's very, very important that you understand the rules of what state you're in. So going along with that, important points to remember are knowing what to get in writing, so which treatments need a written informed consent. You can also understand that in emergency situations, care may be given. So if someone comes in unconscious to an emergency department and they need a blood transfusion to save their life, they do not need informed consent to get that. An incompetent patient cannot give consent. So if someone from, let's say, a mental health facility comes in, it's very important that you talk to their legal guardian about any type of procedure being done. Last thing is that minors cannot give consent. So children under the age of 18 do need their parents' consent to have any type of treatment done. It is very important to distinguish between not giving correct informed consent and then negligent non-disclosure. So basically the difference is consent is applicable when a treatment is proposed, whereas non-disclosure is applicable when an omission of information leads to injury. So for example, a couple sued a practice because they were not given information on their genetic testing results. Later, their child ended up being born with a genetic abnormality that they should have been informed about during the testing process. They sued for informed consent. However, the court ruled that this was actually negligent non-disclosure because they were not given information, which led to harm later on. Patients must be informed of any type of abnormality. There are a few important examples of this. So, for example, a patient refused a pap smear. They were not given the information of why it was important to get a pap smear. So they were not told the risks of refusing the pap smear. Well, that patient ended up getting cervical cancer and dying because the cervical cancer was not caught soon enough. Another example would be a patient came in, their eyes were tested, and they had increased pressure in their eyes. Well, this was not told to them. They ended up having a severe case of glaucoma, and because the pressure was not taken care of soon enough, they ended up becoming legally blind. If that information would have been shared with the patient, they could have gotten help a lot sooner, and this could have been avoided. The important overall thing is to find the right balance between too much and too little information. Too much information to the patient is just not economical. Patients would be in providers' offices for 3 to 4 hours if they were given too much information, and neither the practitioner nor the patient wants this to happen. However, too little information, that is what is considered negligence. And then there's the important point of that patients do have the right to refuse treatment. The important thing is to document all of the education that you've given this patient, and to document that you have told them the risks of refusing treatment. So for risk of poor quality ratings, this is another business risk rather than a legal risk. So ways to avoid poor quality ratings include understanding the performance measures being used, developing systems to comply with performance guidelines, and requesting and obtaining feedback on performance. There are some important performance measure tools to note, which includes HEDIS, or the Health Plan Employer Data and Information Set. This system gathers from patient surveys, patient charts, and billing forms. You also have MIPS, which is the Merit-Based Incentive Payment System. This is Medicare's quality data collection system, and then reimbursements are made based on certain criteria of this system being met, such as patient satisfaction. So if there is some type of indication that an illegal activity has occurred, the nurse practitioner is at risk of disciplinary action. Two very important points to remember are that any reports of impairment, fraud, or criminal activity, along with gross negligence, do run the risk of license suspension or a license being revoked. Another important point to remember is to always hire an attorney when under investigation. Attorneys understand all of the legal sides of being under investigation, and they will help out a nurse practitioner with all of those processes. I've also included here the disciplinary process. There are 9 main steps that occur when a nurse practitioner is under investigation. So what happens is that the NP receives a letter that they are being investigated by the Board of Nursing. The NP then meets with an investigator. The investigator gathers information from first the nurse practitioner, and then they gather information from other sources like coworkers or cohorts or whoever. The investigator recommends the case either be dropped or it be moved to a hearing. An administrative hearing is held if needed. Before this, though, a pre-hearing settlement can be made. The board then decides to either drop the matter or discipline the nurse. Discipline may include probation, suspension, or even revocation of license. If a license is taken, a nurse or nurse practitioner whose license is revoked can reapply after a certain time if indicated. Almost all providers in healthcare are at risk of Medicare fraud, so this is important to discuss. An important statistic to note is that the level of fraudulent billing is such that an estimated 7 to 8% of total healthcare spending goes not for care given, but rather for care not given. So important things to remember are that upcoding for a visit is considered healthcare fraud. So if a patient comes in and you see them for 5 minutes, but you then report that you saw them for 30 minutes and that they're a critical patient, that is considered upcoding because you're getting reimbursed for more than you did. However, if you undercode, so you say that you did actually less for the patient, then that leads to low revenues for a practice. So you want to find the right balance in between and just really be accurate with your coding. Healthcare fraud can lead to audits, fines, loss of provider status, and even loss of license. And ignorance is not an excuse. You have to understand how to code for your billing. Any nurse practitioner who wishes to start a business is always going to have risks involved. Two of the main risks with starting a business are the overall business failure and then relationship failure as well. Good ways to avoid this type of failure include opening a practice by yourself, so not even having to disagree with anyone else. If you do have partners, you want to agree on a decision-making process from the very beginning. Different types of practices that you want to open include sole proprietorship, a partnership, or corporation practices because the systems they have in place are very good. And you also want to make sure to consult an attorney to get all of the legal stuff out of the way right at the very beginning. A good example of this is, so let's say two nurse practitioners open a business together and they're good friends, so they decide we don't need to pay for an attorney, we don't need any of those legal issues, we will figure this out as we go. Well, once they start having disagreements down the line, there's nothing in writing or anything protecting either side from disagreements, and now they're going to have issues with the entire rest of their practice because there's nothing legal binding them to any type of system to avoid those issues. It is very important to note that some patients are a lot more likely to have legal troubles come with them than others are. These are considered high-risk patients, and here we've included a list of things to watch out for. So with patients that have multi-system failure, it's very important to work with a consultant to make sure all of your steps are not missing or anything like that. With a patient with intellectual disability, you want to make sure that their guardian is present for any type of consent. With giving multiple medications and polypharmacy, you want to make sure your patient is fully educated on all of the effects and side effects of the medications they're taking. With non-compliant patients, you really want to make sure to document everything. You want to document the teaching, you want to document the risks, and you want to document that the patient did not consent to any treatment that you're giving them. With positive review of symptoms, try to expand the problem list. So if a patient comes in and they're always doing okay, you want to make sure that you're not missing any steps in the process. With substance abuse, do not be a source for these patients. You do not want to give an opioid addict more opioids. You have to be very careful with this. And the last one is litigiousness. So if a patient comes in and they've sued their last 3 providers, the chances of them suing you then becomes a lot higher. Controlled substances are another extremely important aspect of healthcare, and being accused of prescribing or dispensing these drugs inappropriately can be very dangerous to a nurse practitioner's career. So there are important ways to help lower the risk of prosecution. First is to never prescribe hydrocodone, alprazolam, and carisoprodol together. These 3 together are a very popular street drug, and so those being prescribed together can seem very, very suspicious. You want to follow your current association guidelines, and these include performing and documenting an evaluation of the need for prescription drugs, checking the drug database before prescribing to a patient, making a contract with the patient, ordering urine screens to know what the patient is or is not taking, evaluating progress. If none is made, you discontinue the drug, and you want to understand and follow your state laws. Electronic medical records have become a very important part of healthcare, as most have transitioned from paper to electronic charting. However, they do have both good and bad qualities. They were originally put into place to avoid medical mistakes, reduce costs, and improve care as opposed to paper charting. Benefits of EMRs include immediate record access, improved legibility, standardized documentation with templates, built-in safety mechanisms, and clinical decision support. However, problems include what's called sloppy clickers, or just basically clicking the boxes without actually paying attention to what you're clicking, meaningless documentation, and patient confidentiality issues. The book offers 18 total ways to reduce legal risks involving EMRs. However, the main points of these reduction tactics include just overall risk reduction, template use protocols, tracking features, when a system crashes, having backup data, distraction avoidance techniques to help talk directly to your patient, authorship, timestamps, and overall confidentiality. When it comes to risk management, the pros definitely outweigh the cons. Overall, it's just a way to avoid problems in general, so there's no harm in putting these systems into place. You're going to avoid awful catastrophic events, including potential patient death from an action that you caused. You're going to have legal protection. You're going to reduce internal disputes and how money should be spent when it comes to business. This protects both you, the provider, and the public from any harm. This also helps identify and fix process and system deficiencies. So this graph here is just one way in that risk management helped improve overall patient outcomes. So in April, they implemented a virtual monitoring system for inpatients in hospitals. And as you can see, their falls with injury, as soon as they implemented it, went to 0 for those next consecutive months. The overall fall trends, although somewhat fluctuated, overall went down. So just implementing a system to help manage the overall fall risk helped overall patient outcomes. It is important to note that there are some cons or just some issues in general that come with risk management. So you have increased scrutiny overall on providers and organizations. There is an increased cost to keep up with regulatory practices. The question of, is risk management cost effective, or is it better to just retain the risk if it happens, has to come into mind. There are more demanding protocols overall, which staff may be less likely to follow. And employees have an increasing right to whistleblow on their organizations, leading to an uptick in audits. Overall, the healthcare industry is very complex, so sometimes things are not black and white to follow in a system. The impact of risk management for nurse practitioners is very significant. Risk management is not only for healthcare. Risk management is used in all types of business practices, healthcare included, and with nurse practitioners included. Every single point discussed in this chapter directly affects a possible nurse practitioner's career. A simple decision that a nurse practitioner makes with risk management strategies can change the entire course of their career and can even change the course of your life if it is serious enough, which I will discuss in the next slide. Financial, legal, and personal consequences can occur if risk management is not taken seriously. On this last slide, I've included an example of one of the worst consequences that a nurse practitioner can face if they don't take risk management seriously. So this is a picture of a legal trial of a nurse practitioner from Anchorage, Alaska, named Chris Kyle. She is currently on trial for manslaughter and 17 other felony charges. Essentially what happened is a friend of hers called her or texted her or Facebook messaged her saying, "Hey, I'm in pain, I need these drugs." So the nurse practitioner prescribed her friend opioids, which ultimately did lead to her death. This person was addicted to these prescription drugs, and those prescription drugs she overdosed on and died. The autopsy they did found diazepam, oxycodone, and alcohol in her system. So now not only is a person dead, but this nurse practitioner faces a long time in prison because of her actions. Thank you for watching, and I hope you enjoyed this presentation over Chapter 8, Risk Management.